doing some housekeeping for this session. So the recordings, we will be recording this session for those who can't make it or for you to rewatch this later. Recordings will be available for up to 30 days when put up. We are pinning the video so that only the presenters will be recorded. This means you can choose to keep your video or audio on or off. And if you speak, the recording will pick your audio and not your name. You can type your questions in the chat box if you prefer. And depending on the presenter, you could private message them as well. Please keep your audio on mute whenever you are not speaking. Otherwise, we might pick up your background noise. We encourage you to check our Sugar and Spice Facebook group for latest updates and announcements. Regarding consent, please do not contact other participants outside of the festival without their consent. You can always ask them for permission through the festival or Facebook group before messaging them. We do not want instances of participants feeling violated or unsafe. For emotional support, please email us at emotionalsupport@sugarandspice.asia. So for this session, Physician Edmund is a local Singaporean who graduated from Nanyang Technological University and Beijing University of Traditional Chinese Medicine with a double degree in both Biomedical Science and Traditional Chinese Medicine in 2014. Edmund's interest in advancing his knowledge and skills in the TCM's role in aiding women's health and fertility inspired him to pursue a master's in Gynecology from Liaoning University of Traditional Chinese Medicine in 2018. He was previous head of fertility department in Tong Chai Medical Institution before leaving for private practice. He's bilingual and with keen mind on the latest TCM research. He uses clinically proven evidence-based treatment approaches to help and guide his patients to successful conception, post-delivery, and management of women's health all stages of life. He treats patients with premenstrual symptoms such as irregular, painful, or heavy menses, no ovulation issues, pregnancy symptoms, nauseous to postnatal care complications, or postpartum issues. Also conditions such as endometriosis, polycystic ovarian syndrome, unexplained infertility, menopause, and gastrointestinal disorders, to name a few. What a mouthful. So I'll hand this over to Physician Edmund for your presentation. Thank you.
Okay, thank you, Fiona. Okay, good evening, everyone. My name is Edmund, and I'm very honored to be here today with Sugar and Spice and to talk about a topic that is very close to my heart because we do fertility. I mean, we see fertility almost every day. Okay, so my topic will be recharging sexual batteries. I need to say that means from an holistic alternative viewpoint into our sexuality. Sorry. Our sexual approach. So sorry. Okay, so I think a lot of social media, a lot of, whatever they read on the internet, there's a lot of information now. I think it's an information overload age, and I think we need to discern and filter whatever that is useful to us and whatever that is probably not that useful or maybe even harmful to us. So I think in the next few slides, I'll go through that. But before that, maybe we'll go into one case study first on how actually TCM can actually help to address certain sexual issues that, couples or, just like anyone's actively, trying for babies. And vaginism, one of the most common condition that I think a lot of women may face, but probably a little bit more afraid to speak out of, because or maybe they don't even know they got this condition. So I have one patient, 31 years old. She's trying to conceive, And she was diagnosed with vaginismus in June 2020. Well, I mean, she's been trying for, I mean, since 2019, but she don't know she has this condition, and it's defined as uncontrolled involuntary spasm of the vaginal muscles. It's more of a phobia of penetration. So they, every session in the course is a stress to them, and especially, when it's time of the month, and that's where that is the most stressful period. And so she has been using dilation and lubrication. I think this is quite commonly used for people, I mean, women with vaginal that with dryness during intercourse, painful sex, and the process, can take up to 45 minutes to an hour for them, and is resulting in difficult penetration and sometimes very frustrating period for the couple. So came to our clinic January 2021 this year. So this is their third IUI, intrauterine insemination. That means the insertion of sperm into the vagina, bypassing the process. So this is to address a certain portion of people having fertility struggles. So this is their third IUI. That means the first two wasn't successful. So in January 2021, in the middle of IUI, so we did, we did 3 acupuncture. And during that, during the third session, this is the first time that, the guy managed to ejaculate into the cervix. Now, how this is by, by the words of the lady. How she actually differentiate that. It's there's up to any individual. So by third acupuncture, so this is the first time that throughout the entire 2 years of marriage that actually ejaculation actually happens. Something that seems very easy to majority of the couples. Actually, this is a struggle for people trying to conceive with this condition. So the second cycle on the fourth IUI. So of course, something out of the unexpected. So menstrual cramps for her suddenly reduced, from a scale of 8 to 3. She mentioned that her menstrual cramp is like never before since she started working. And we did 2 more times acupuncture, and she felt better. They performed intercourse, and the first time that they ejaculated into the vagina for the first time with much lesser lubrication. So no longer feel pain in vagina. This is, out of the IUI process, definitely, of course, but they also did IUI during that cycle. And one day after the IUI, they managed to, they also managed to perform intercourse without much difficulty. And during that cycle, they got it's a positive urine HCG test. So now she's in her first trimester, still within our clinic. Trying to, we just do acupuncture throughout the first trimester to prevent miscarriage. And she's still with us. Hopefully, it's a healthy pregnancy throughout. So what I'm trying to say is, okay, so TCM can mean vaginismus. This is a condition that is created, I would think that maybe in the last, probably within the last few years, or maybe 10 over years ago. And TCM has no knowledge about this condition. Yet, can acupuncture actually help such patient? Definitely, because TCM looks into patients, looks into every single one, every single individual from a holistic point of view. And majority of us who are having issues with sexual intercourse, probably having issues with libido, trouble maintaining erection, sustaining erection, premature ejaculation. That's for guys. And for some reasons, having difficulty conceiving. So I think we'll look into these 3 major aspects during today's presentation. So maybe I'll go into some kind of reasons that account for low libido. Now, stress, overweight, this kind of thing, everything, I think this is quite common. But to a certain extent, I think that we have to accept that it's normal for sexual desire to wane off, to reduce, especially after a pregnancy, after illnesses, or during menopause, or maybe in just times of stress, as well as lack of desire, arousal, failure to orgasm, painful intercourse, tiredness, and don't feel good about their own bodies, enjoy the experience due to stress. Now, stress has overtaken us. I think that in modern times, because I have a lot of patients that work all the way until 12 a.m., 11 a.m., and sometimes due to different time zone now with Zoom, working has become universal, and you have to work through your sleep because you have to work with someone that's opposite the group. So, of course, when you are working with such irregular timing, it's common and it's usual and it's normal for your body not to want sex, not to have sex any time, because your body is not ready for that. Your body is ready for sleep, for rest. So this is causing a lot of stress to our body. So there are a lot of reasons for low libido, and I think we need to really target on what is really that reason. And I would say that for the majority of them, that's stress. Now, stress is not just about work stress. Okay, maybe I'll go to the next slide first. Stress is not just only about prolonged work, mental stress. It can be due to zero exercise or excessive exercise. That means they've been working out 1 hour for 7 days a week. I'm not sure, because in recent social media, a lot of attention is on cardio exercise, a lot on HIIT, high intensity. This actually creates a lot of stress on our body. And for those who are not, well adjusted, well suited to the high intensity exercise, we can actually cause this thing called hypothalamic amenorrhea. That means your menses will just stop. Your body will think that, okay, it's time to stop wasting my resources from menses. So I'll just stop the menses. Your menses can, be delayed for 6 to 12 months. Lack of sleep, definitely. When it's time to sleep, you're not sleeping. When it's time to eat, you're not eating. When it's time to go to pee, go to poo, and you're not doing that, that is causing stress to our body as well. Lack of sleep, cannot emphasize anymore. I'll go into that into detail later. Chronic pain, some with, I have a patient, with lower chronic back pain, and this is causing him to have normal sexual intercourse. Now, so of course, if you can't have normal sexual intercourse, right, then after that, of course, you cannot try to conceive lah. So, and they don't want to go through, IVF or IUI. So this can be one of the things that causing you stress in the body, as well as causing stress in your fertility journey. And chronic energy zombies, I think this is one very important. What I mean by that, toxic relationship around your family, around your working environment, around your social circle. When you stand beside this person, when you sit beside this person, you tend to be very exhausted, and that is your energy zombie that you have to move away, go away from them. Poor diet, now no breakfast, skip meals and late meals. Now intermittent fasting, this is something of a very new norm, and a lot of us actually skip breakfast. Now I have no issues with intermittent fasting as long as you are sticking to it diligently, i.e. to say 16-8 means 16-8, not 16-8 on Monday, nothing on Tuesday, nothing on Wednesday, 16-8 on Thursday. Diligently means 7 days per week. Only then your body will think that, okay, it's your body, you have sort of like adjusted your body towards the timing of when to produce gastric juices. If not, you're confusing your own body. That is causing you stress as well. Skip meals. I ask my patients, what time, are your meals regular? Yeah, I'm regular. What time are you having your dinner? Oh, I have my dinner at 10 p.m. almost every day. And that's regular for me. So is that regular? Of course it's not. We are not programmed to eat dinner at 10 p.m., 11 p.m., 12 a.m. No. Yeah, so our body is actually, we go according to the sun. There's this circadian rhythm within our body that we actually follow. And if you are not follow according to that, that is causing stress to our body as well. So there's stress and holding grudges, undigested emotions. So digestion is not just about food. Digestion is about your thoughts. Digestion is about your emotions. If you are hating someone, like someone actually said something that actually hurt you, that night probably you couldn't sleep. And that night probably you don't have enough appetite. And that night probably, you can just be very stressful over this person. So that is stress. So I hope I've gone into detail what stress is actually is. not just only on working. And how does it affect our body? So from a hormonal point of view, so now the first part, this is cholesterol. I also have to emphasize that our diet has to be clean. Now there's a lot of us that actually order Grab delivery, delivery food, and we leave our health, we leave our nutrition and diet intake on the hands of someone who don't really care about that. Am I right to say that? Because only when you cook for yourself, then you will take care of what actually goes into you, and you are what you eat. You are what you digest, and you are what you absorb. If you take in, trans fats almost every day, you take in like fried chicken and all those oily stuff, then of course your body is going to use all this unhealthy stuff to make unhealthy body components of your own body. So cholesterol has to be, I will say that, if we can take in healthy cholesterol, that means, things like avocado, things like nuts, coconut oil, those healthier fats, healthier oil. These are the parts that actually, can make better hormones. So cholesterol goes to pregnenolone and then to progesterone. And the other pathway that is from DHEA and to testosterone. Now, testosterone is the one that actually causes us to have sufficient libido. A lot of us that with low libido, trouble having erection, then you start to taking testosterone pills, try to pump up, taking protein powder just to make our testosterone increases. However, our body can actually produce sufficient testosterone. It's just that we are tricking ourselves to produce more of the other pathway that is known as cortisol. This is a stress hormone. And this stress hormone does two main functions. One is to pump blood to the heart. Second, pumps blood to the brain at the expense of your uterus, at the expense of your testes, as well as the muscle governing the entire pelvic region. Why? Is because your reproductive system is usually usually the first to go when your body is under stress. Why? We don't need reproductive system to survive, but we need our cardiovascular system to survive. We need our neural system to survive. So our body will tend to direct these resources to places that need them more. That means, if you have been working and you have been under huge stress, of course you don't have the mood, to have sexual intercourse. That's a norm. That's a normal thing, because our body will think that, you'll be better off sleeping instead of trying to have sex. So cortisol is something that is meant to protect us. However, when we are on chronic stress, this cortisol will actually, cause us more harm. So there's this thing, this is a sympathetic nervous system, this is the parasympathetic nervous system. This is the one that causes us to be irritable and anxious, a lot of high stress kind of symptoms. And parasympathetic, this is the one that acupuncture, this is the one that yoga, meditation, breathing exercise that is supposed to, that is trying to activate the system. Now, when parasympathetic nervous system is being activated, I would say most of the time during your day, you have no issues with your libido. You won't be spending money on Viagra, spending money on testosterone pills, because all these are free. You can actually do it yourself. It's just that we are tricking ourselves into cortisol overdrive by all these factors. So are they important? Of course they are important, but how much attention are we actually spending on this? The first thing that we think of is I must get a pill. I must do an operation, I must do a surgery, just to make sure that my libido is good. So this is something that we can actually, help ourselves with. So how can TCM actually help? Now, TCM, we look into both two organs, kidneys and liver. Now, this kidney is not the kidney that we think of, that we learned during our bio days, biology days. No. Kidney refers to our reproductive system in terms of TCM. Kidney refers to our urinary system. Liver refers to our energy within the entire body. It refers to our assimilation system within our body. So better kidney and better liver. These are the two things that actually helps to stabilize the yin and yang energy equilibrium within ourselves. This includes the state of sexuality and desire. Okay, so TCM liver governs our stress and emotions, and our energy flow. Then reproductive system, as I mentioned, is always the first one to go under times of stress. So when we have enough kidney energy and smooth flowing of energy, liver energy, that's where that we have our sexual drive. So these are two things that we actually always look for regarding symptoms that any patients may have. Then after that, then we start to address these issues. And this is how we actually diagnose our patient, from the looks of your appearance, your demeanor, the loudness, or how you present yourself during consultation, and your symptoms, as well as palpation. That's where that we see your pulse, and we feel the general energy, and that's where that we come to a conclusion of your diagnostic syndrome differentiation, and then we do our treatment. Treatment includes herbs, acupuncture, moxibustion, tuina, and also some other smaller forms such as auricular, which is the ear thing, auricular acupuncture. All this helps to treat the imbalances within our body. Imbalances between what? Between your parasympathetic and your sympathetic nervous system. So 4 ways how acupuncture can actually help our libido. So first thing, of course, it helps to improve your blood circulation. Most importantly, it brings your body, mind, and heart in sync. There's a lot of couples out there trying to hit the ovulation timing, trying to have sex during that time, but their mind and their body are totally two different things. I'm not sure if you understand what I mean, because you are just performing the act just for the act, just to try to get pregnant. But your mind might be thinking that I'm working tomorrow, what should I do, what should I plan? And that is where that you won't be producing enough or good sperm or good eggs during then, because your mind and body and heart is definitely not in sync. And when it's not in sync, that is stress as well to the body. Second thing, balance out your hormones. Of course, there are a lot of reasons that your hormones can go out of balance, as I mentioned earlier on. And relieve stress. This is the most important thing that acupuncture can actually help with if you are not needle phobia. Now, if you're not scared of needles, acupuncture can actually relieve stress for you. Now, if you are scared of needles and you're going for acupuncture, it's actually very stressful, then I'll think that tuina or fertility massage that might be more useful for you. And review, from TCM consultation and from acupuncture, you can actually review a lot of other issues that contribute to your lowered libido. For example, vaginismus, for example, endometriosis, painful menses. Then of course, when your muscles are very tight in the pelvic region, you will have problem having proper intercourse. So, and also, acupuncture together with Chinese herbs, that's what we actually usually do. This will help to address hormonal issues like low testosterone. As I mentioned, low testosterone is not necessarily an issue. It's more of an issue of an upper system. That means your parasympathetic system is on the low, is inactivated. Sympathetic nervous system is always on the high. And that's why we push down our sympathetic nervous system and boost up your parasympathetic. And the needles, this is probably what we usually see, help to improve circulation around that area. Most importantly is to trick your mind, to release the stress relieving hormone, try to reduce on the cortisol level. And out of the four kind of usual symptoms accompanying low libido, this is, as I mentioned, kidney and heart. Lack of arousal, that's what we actually treat as well. Failure to orgasm, as well as painful intercourse. Now, these are just basically how we actually view them. Now, we don't have to know this stuff. Just need to know that if you're having problems with any of these issues, acupuncture and Chinese herbs can actually, help you if you're looking for a holistic alternative treatment. Second case study that I think that is quite useful in this presentation. I think, erectile dysfunction. This is a diagnosis that, usually men will give themselves before they actually see the doctor. I couldn't sustain an erection. I think I'm having erectile dysfunction, ED. Now, of course, there are a lot of factors causing that. Majority of them is actually functional erectile dysfunction. It's not an obstructive dysfunction. That means to say obstructive is something that's being blocked. You're having varicocele. Varicocele, that means the veins are actually enlarged within the testis area. It's just like on those, I mean, there are some elderlies, when you look at the back of their legs, there are a lot of veins that are actually enlarged. These are varicocele. This is called varicose veins on the legs. So varicocele is a term that is mentioned that's used to reflect on those, I mean, enlarged veins on the testes, around the testes. So obstructive ones that you have to go through surgical intervention. However, functional erectile dysfunction is usually just caused by the thing that I mentioned earlier on. It's about stress. Why I mentioned, okay, I just go with that. So usually people with erectile dysfunction, they are more jittery. They are very, in terms of Chinese, we call it ganzhong. They are very anxious. They are very easily paranoid. So I have this patient was diagnosed with anxiety disorder. He's on antidepressant medicine, anti-anxiety medicine. So heart palpitation in enclosed areas. That means when he's alone in this room, he will have very serious heart palpitation and easily losing his temper towards his wife, towards anyone that he sees. So of course, usually when we have such patient, they usually have problems sustaining erection. So out of 5 intercourse, out of 4 times, he couldn't really sustain erection. So he came into clinic November 2020, I mean, which is I think 4 months ago. So we started treating on him. So after 3 weeks of herbs and 3 times of acupuncture sessions, he told me that he can perform intercourse twice per day. Previously, that's out of the question. Now, is this something very amazing or awesome regarding like you can perform intercourse twice per day? I think that's very normal for guys if they want. You know, of course, you know he'll feel very tired the second time, but it's something that he hasn't had. I mean, he doesn't have this desire or libido to do that twice per day. So this is something that he actually, you know, discovered that himself. But I have to say that he is a very, very compliant patient. I need to say that means I asked him to do, I know, stretching exercises, to do yoga, to go for regular walks and to exercise. He absolutely nailed it. He just listened to me and without much, you know, he doesn't argue back. He doesn't find excuses to find ways to avoid my suggestion. So I have to mention that compliance with diet, lifestyle, and exercise is very, very important. Acupuncture is just a passive treatment that is just to address and help to regulate the disharmonies and the bad the things that are out of balance within our body. However, the next moment when you're back to your old lifestyle, you're sleeping back at 1, 2 a.m. and you're having stress the entire day without exercising, without any good diet, it's very difficult to help yourself. It's very difficult for others to help you. So compliance with any suggestion from your doctor, from a physician is very important. So for those who are, you know, trying to conceive, for those who are having problems having a baby, now how Chinese herbs can actually help from a clinical evidence-based approach, improve your follicle development, endometrial lining, pregnancy rate for PCOS. Basically, that means you help to improve on ovulation and help with endometriosis, painful menses, sperm quality, and preventing miscarriages. Acupuncture, same thing. As I mentioned, boost up on your parasympathetic nervous system, affecting your blood flow to the uterus and making you more happy, endorphin production, and reducing on stress, and also help to improve pregnancy rate. So this is a study done. So I just want to point out to you that disturbed sleep, I need to say that means a low sleep quality is associated with increased risk of menstrual irregularity, lower sperm count and concentration, and a lower percentage of sperm with normal morphology. So what does this mean? This means that sleep plays a very important role in our reproductive system. Sleep is indirectly affecting our reproductive function. So try, if you're having low libido, problem sustaining erection, wake up from a nap and to have intercourse if you're trying to have trying to conceive, or make sure that you have a good sleep, good nap, and try to see the difference. It definitely really helps. That is if you change your lifestyle, and this thing I'm sure any doctors cannot help you with that with your own sleeping timing. But sleeping and fertility plays a huge there's a huge relationship between them. So other benefits, sperm quality, lining, regulate hormones. Basically, these are the points that acupuncture can actually help our sexual problems. Now, how can we help ourselves? What can you do on your own to actually help in terms of your fertility? Of course, find yourself a good acupuncturist, find yourself a good physician that can address your disharmonies within your body, the imbalances within your body, and as well as to help with your energy level and stress reduction. Find a good TCM physician, to help with your problems, because your constitutional has to be addressed. Your kidney deficiency, your liver stagnation, a good formula will be good. Consult a doctor. Regarding hormonal issues, are there any other hormone issues that are affecting your libido? Things like thyroid, things like Cushing's syndrome, your long-term use of medication, other undiagnosed medical conditions. Hypertension can cause that, diabetes as well, and exercise. Now, what kind of exercise? Exercise, there are a lot of exercises. It depends on your goal. Now, if your goal is, if your BMI is 40, 45, way overweight, then of course, things like HIIT or cardio is useful for you to reduce weight. Of course, you don't have to do it 7 days, 1 hour each day. 3 to 4 times. If you are doing HIIT, 15 to 30 minutes will be sufficient. And of course, if you're losing weight, make sure diet plays a more important role than just exercise. Okay, the way that you eat, and if you're following a ketogenic diet or intermittent fasting, make sure you stick to the principles of it. It's not when you're happy you go on it, when you're not happy you skip off it. Okay, so now, however, if you are not losing weight, if you are no acceptable weight or even underweight, and you have low libido, then you have to switch. You are not suitable for HIIT. You are not suitable for cardio. You need to look into something more gentle. Things like yoga, things like Pilates. These are the ones that can reduce your cortisol, reduce your metabolism, so that you can gain a little weight, and that's where they can help your libido. Diet, of course, definitely go clean and green. I'll go into that later. Strengthen your pelvic muscles. Now, there's a lot of pelvic strengthening exercises, like things like Kegels exercise, to help with your pelvic muscles. Now, if you are disciplined well enough, go ahead and do it. Strengthen your pelvic muscles. And this is very important if you are, having things like premature ejaculation. Yes, this is very important. Or if you are having troubles containing your urine, that's also one thing that is very important for you. Now, set aside time for sexual intercourse. Because if this is something that is out of the blue, good, spontaneous, good. However, if you have been working, and you have been busy with some things, you have absolutely no time for sex, then your body, one day, you won't have that libido anymore. So in Chinese, there's this saying, 不用则废. When you are not using it, it will go to waste. Same thing for, our sexual libido. If you're not using it, definitely, you'll go to waste. Yoga, very important. Now, for those who are more into holistic, for those who are doing yoga, for those who have some basic knowledge about Ayurveda, we know there's a lot of chakras within our body. Now, these are not something that's very mystical. These are just points within our body that if we practice meditation, if we practice breathing, we can actually, focus our energy on certain chakras. Now, okay, so this is just for general information for those who are, who are doing yoga. The second chakra, the sacral chakra, this is the one that's associated with our sexuality, our pleasure, our libido. We need to feel balance within this area. So acupuncture, sometimes, when we do that, we're actually, stimulating energy within this chakra as well. Now, how can you actually stimulate this energy on your own, on a very mild level? You look at on the top right-hand corner, this Muddaksana, this is a pose. Now, this is where you are sitting down on the floor. The heel of one leg, either your left leg or your right leg, is pushing against the area near your genitals, in between your we call it perineum, in between your anus and your sexual organ. So this is the area that is, when we put our feet on, we put our heel towards this area and we keep it up and we sit up straight, we will feel this pressure on our perineum. This can actually help to stimulate it. And this is a point in TCM used to address infertility issues, used to address erectile dysfunction. Now, of course, this area is very difficult to access to access to this area from, from a third-party point of view. So we can do it on ourselves, all the best, we can do it. So this is sacral. Second pose that I think that a lot of us should be familiar with, this is bound angle pose, stretching on the pelvic region. This is very important now, because a lot of times we are sitting down, the pelvic muscles within this area. And I have this human body here. Okay, I don't think you can see that. Okay, okay, never mind. Anyway, so this area within the the pelvic region is shortened, is tightened when we are sitting on our chairs, for 8 hours every day. By doing this pose, we are actually lengthening, and it increases the blood flow to our reproductive organs, and that's where that it helps with your libido. And pigeon pose, look at the leg behind. This leg here, when we are doing it, we are stretching it, because this is in a position that we seldom get into. This also helps with our pelvic region blood circulation. And lastly, diet. So what should we eat? What should we not eat? I have a lot of questions, regarding fertility diet. And foods to avoid first, of course, trans fats. Trans fats, I need to say food that is actually cooked outside, because the oil is being used multiple times. Even if you are taking something that is very so-called, that is so-called healthy, which is vegetables, the oil that is being used to cook the vegetables has been fried in meat before. They reuse the oil. Definitely, I'm sure those, in F&B, you will know that. So how should we move from here? Make your own meals, if possible. Okay, because trans fats, it's not just affecting our reproductive system, it's affecting our cardiovascular system. And a lot of times, you mentioned that, how can someone get cancer that easily, tumor? Why is it me that is having this cancer? Basically, it's basically due to our dietary intake since the past. Trans fats has been proven, in clinical studies, that it has ability to increase the chances of cardiovascular risk, stroke, hypertension, high cholesterol. Yet nobody is paying attention to it. Okay, so refined sugar, anything that is added sugar outside, things like bubble tea, things like your brownies, your cupcakes. Now, of course, we cannot avoid now, but we can reduce. Animal protein, you go for more clean protein. Excess caffeine and alcohol. Sorry, give me a moment. So complex carbohydrates. Sorry. So complex carbohydrates, things like your brown rice, your black rice, your red rice. You try to reduce on white flour, your white bread, your things like your chū gui, sum gui, peng gui. All these are simple carbohydrates. Can reduce on that, increase on more complex carbohydrates. Sorry, I've been talking for a while. Hold on. Okay, so lean protein, preferably plant-based. If not, that if you can try to get lean protein, that's even better. Healthy fats and water. Make sure it's well hydrated. So healthy fats, as I mentioned, your nuts, your avocado, your chia seeds, your flax seeds, omega-3. Good sources of omega-3, the algae omega-3, fish omega-3. All these are actually helpful to us in terms of producing good hormones. So one thing that's not mentioned here, fiber. There's a lot of, a lot of us, things that going to the bowels, going to the toilet for bowel movements 2 to 3 times per week is normal. It's actually not normal. You should be going every day, if not every other day. You shouldn't, last up to 3 days, then after you go to the bowels once. So fiber is very important. Pre and probiotics is very important if you are having inflammatory conditions, things like endometriosis, PCOS, thyroid. Of course, seek your healthcare provider advice. So fiber is also very important. That is to help off to remove excess things that is being stuck out. There's a new term these days. It's called estrogen dominance. Excessive build-up of estrogen. That's where that a lot of things like fibroid, ovarian cysts, breast fibrocystic cysts. So these are due to estrogen dominance. Fiber is the one that removes whatever excess that is being produced within our body. So that's very important. So last thing, I'll just introduce 3 acupressure that we can actually press on ourselves. And before I end this conversation, okay, so acupressure. So practice by taking a few deep breaths and go in circles, 30 seconds to 1 minute on the points. The first point is on the leg, the inner side of the leg. So on the inner heel, there's this ankle, the inner ankle, just towards the back of the inner ankle. This is the point we know as Tai Chi. This is the one that actually helps to nourish our kidney. Nourish our kidney, and kidney, as I mentioned, kidney and liver is very important for our reproductive system. So this is the point. You go in circles 10 times, and opposite direction 10 times. Whenever you are doing things like watching TV, when you're waiting for someone, you're doing nothing, but you're watching drama, on your phone, press onto that. That can actually help. Sometimes you'll feel a tingling sensation. That's very useful as well. Second, this is Bai Hui. It's at the tip of the top of your head. This point in TCM, it just means it's the collection of the entire yang energy within our body, because it's directly the highest towards the sky. This point, just by pressing here, press on your own. Okay, go in circles, clockwise and anti-clockwise. You should feel some numbing sensation, a very dull ache kind of thing on the top of it. There's a point, it's very useful for increasing the yang energy within our body. The third thing, Ren 6, Qi Hai. Just 2 finger spacing down from your belly button. This is the point that if you have a heat pack, you can place it over the entire lower abdomen. That helps with circulation within the pelvic region. And by pressing on this point, going in circles, same thing. If you are familiar with moxibustion, you can place your moxibustion stick on top of this area as well. So this is the point that actually rejuvenate, helps to waken up our sexual libido and ability. Okay, so with that, I end my sharing here today. Thank you so much for holding up all the way until, I think it's 45 minutes. And any other questions? If you have it, I'll pass the time back to you, Fiona.
Yes, hi. Thank you so much for your session. We have quite a lot of questions though. Okay.
Okay.
Okay, let me see. One here is that okay, stress also can make people more interested to have intercourse to relieve stress. Do you encounter that, or have you experienced that?
Sorry, I actually don't get the question. So that means like you
Regarding stress, will make people more interested to have sex to relieve stress because they're so stressed out, so they want to have sex. Is that true? Or?
I think if that's an avenue for you to de-stress, I think it's quite good because I mean, sexual intercourse should be a pleasure. It should be a pleasure. It should be a very joyful, fun thing to do. It's just that, in fertility patients, is patients trying to conceive, it has become more of a stressful thing instead of a pleasure thing. So I think, because in clinical practice, we see patients more of like having sex is a stressful thing instead of stress to have stress. Then after that, you want to have sex. But of course, if this is overdrive and you're becoming an addiction, then I think that it's better to take a sex expert like Dr. Mata. I think she'll help you more with that.
Okay. There's another one. What about those who work night shifts? How will the circadian cycle be affected?
Okay, now night shift, it will be very, very affected. Okay, why? Is because we cannot adjust the time of sun. You cannot adjust the time of moon, but you can only adjust the time of our own. So this is different from jet lag because when you go to another country, the sun will still rise and fall in morning and evening. But in terms of like if you are working night shift, then we are actually working against nature. And when we are actually working against nature, we won't be having the fruits of nature. I.e. to say, people by nature, you should be able to have good libido, good sperm, good eggs, and supposed to conceive. Now, if you work against nature, definitely that's causing stress to your body, and definitely you won't be so well off unless you are young. When you are 18 years old, 16 years old, you can, the entire night party all night, and in the morning you still can have like intercourse. That's fine. That's fine. But when you are talking about 35, 30 years old and above, then it's time to listen to our body. And there are people who need to work night shift. I do understand that. It's just that you have to be prepared to pay off. That's the consequence of working night shift.
Okay. Then regarding the diets, with all the clean eating and all that, are we allowed to have cheat days?
Definitely, you can have cheat days. I have to be strict in my I have to say that, okay, avoid this. By human nature, there's going to be someone who is going to say, "Aya, never mind lah, today is okay lah, today I just take lah, tomorrow then I just continue as per usual." If I just mention that, okay, it's better, out of 5 days, you can take 3 days of fried chicken and 2 days, you just have ice cream, then nobody will listen to this advice. So it's definitely okay to have cheat days at your own discretion. Just that you make sure that you know that, okay, for this week, I've taken like one big portion of pizza. Then the next day, another pot of big mala spicy stuff. Then after that, together with a cold pao pao cha, then I'll know that for the rest of the week, I have to be a good girl. I have to be a good boy. I have to look out for my diet. This type of thing. So I'm thinking as responsible adults, we won't want to harm our own bodies.
Okay. Then there's what does not sustaining erection mean? Do you go by length of time?
Okay. It depends on what kind of motive you are looking at. Of course, for pleasure time, the longer the better. But of course, if you are just trying to just conceive, then the motive should be from the intercourse, and you're able to erect and ejaculate, then that's it. Now, not sustaining erection means before you even ejaculate, erection goes off. So then you cannot achieve your motive of trying to conceive. You cannot achieve the motive of having a pleasure sex. So that's what I mean. It doesn't mean by time like, okay, everyone should sustain erection for 30 minutes. No such thing. Everyone is different. So as long as your motive is being reached and your erection holds on till then that's fine.
Okay. Back to the diets. If you go every day more than once, do you find that normal?
Normal. Okay, bowels 2 to 3 times as long as your stools are formed. You don't have abdominal pain before going to the toilet, and you don't rush to the toilet, diarrhea, this kind of thing, then it's normal. However, if you are going to the toilet, every time with abdominal pain, very loose stools, 3 times or more per day, then that's abnormal. You need to get yourself a good physician to help you with.
Okay. How would moxibustion work? Did I say that right? And how often does it need to be done?
How would moxibustion work? Okay,
Yeah.
moxibustion is like a cigarette. It's like a big cigarette, and okay, I'll just take a pen. I'm not sure you can see. Okay, never mind. Okay, so it's like a big cigarette, and there's one point. I mean, both ends you can burn off. So when you burn off, right, then after that, you start to create heat within an area. This entire stick, you hover it around the acupoint that I mentioned earlier on. So on Qi Hai point, which is this point, so you hover it, around maybe 1 or 2 inch above your skin, then you should feel this kind of warm sensation within the area. So you are actually pushing in the yang energy that your body needs at certain points, because acupoints are the points where you can actually absorb heat most. So acupoints, I mean moxibustion around these points and can actually help to boost the circulation within the area, and the acupoints beneficial therapeutic benefits. Yeah, so that's for moxibustion. How often does it need to be done? I would say every alternate days, one time probably around 10 to 15 minutes per point. Yeah, so your hand is actually quite tiring. So you need to get someone to do for you if you have the luxury. Okay.
Okay. I think that's all for questions in the chat. Anyone who's watching, you can unmute if you are comfortable. Or we still have another 8 minutes. Physician Edmund, I have a question. I know you touched a bit on PCOS. Maybe you could explain a little bit further.
Okay, PCOS means polycystic ovarian syndrome. Now there's a few criteria for the diagnostic assessment to be made. Like for example, certain hormones like your LH over FSH has to be 2.5 and above. Then after under ultrasound, you have to see like maybe more than 12 or more follicles. And basically, in a nutshell, it just means that your periods are quite irregular. Anything ranges from 30 days to 90 days per cycle, and it's very difficult to gauge your ovulation. Now, even if you do ovulate, the follicles might not be of the best quality. So that's where that acupuncture can help to regulate the period, as well as your diet, because PCOS is inflammatory disorder that can actually be fueled by inflammation from our diet, which I mentioned earlier on. So if we can change our diet and our lifestyle, and with herbs and acupuncture, it can actually help to push from maybe 90 days back to 75, back to 60 days. Yeah, but PCOS is, if you are urgently trying to conceive, then of course you can combine with, acupuncture and herbs can combine with Western intervention as well. Things like Clomid or letrozole, that's for ovulation drugs, as well as for IVF. This can help as well. Okay, I saw new questions, right?
Yep. How hard is hard for erection?
Also measured by TCM. And that's so how hard is hard? Hard enough to penetrate, that's hard. Okay, hard enough to penetrate and hard enough for pleasure to be achieved lah. Most important. So okay, sorry. So Fiona, I can just read off the questions.
Yeah. Okay.
Okay, so TCM doesn't do touch internally into vagina for people. Yes, of course. Yeah, we don't needle on areas that I, as a guy, as a male, that I cannot access to. Okay, so I'll just do points that is above. Okay, your lower abdomen. Lower abdomen, that's the area that we target most of the time. Now, this is only for local circulation, because as I mentioned earlier on, vaginismus is not just on the local circulation, it's on the entire body regulatory system. So not just on your vaginal muscles that are very tight, it's more of the entire body muscles that is very tight and tense. It has to go to to your personality and character and how you live your life as a whole. So this is something that you have to look into as a global, holistic viewpoint. Yeah, so I don't do that internally, definitely. I may get sued, So, okay, so for those with various hormonal issues, endocrine issues, will moxibustion and acupuncture help to overall libido and fertility? Definitely. Of course, you have to depend on what kind of endocrine problems that you may have. I think that you might need to seek for a more detailed assessment before I can really answer this question. When to learn Tai Chi in Singapore? I work flexi hours. Okay. Where to learn Tai Chi? Sorry, I'm not I don't have any context Tai Chi in Singapore. Tai Chi, if you're interested, things like Qigong or Tai Chi can be learned on YouTube. And as long as as long as you are not overly obsessed, just by practicing things like yoga, as long as you observe the safety, I don't think that's an issue. Because now I think there's a lot of internet. There are some really good ones online teachers, but of course there are also bogus ones. So you have to be, must have the wisdom to discern and filter. TCM and cancer, can TCM help? TCM and cancer depends on what kind of cancer, depends on what stage are you at, depends on are you undergoing Western intervention that has already caused your body to be a very, very severe deficient state. It depends on which stage that you are at. But definitely TCM can help in one way or the other. Definitely if you are taking chemotherapy, you cannot take herbs. Acupuncture can help as well, but that you have to seek your doctor's approval lah. Tofu or carrot heart, that has to depend lah. I mean the genetics, the genes of this guy. So what is a good way to find a qualified TCM physician? This one I think TCM physicians are licensed and regulated by TCM PB. That is our governing body. Now, if you go to our website, TCM PB website, it governs Singapore's TCM physician. I would say most physicians are legit lah. They are legitimate. So finding one that you have a good rapport with, a good conversation that you can hold with, that's the best way to find out. Just by online Google review, think someone may work for someone, but might not work for you.
Last question. These acupoints are same for male and female?
Yes, correct. They are same for male and female.
Okay. So yeah, 2 more minutes. We have so for those who need some emotional support, we have an email and we can get to you and help you out. And there's also a feedback form. Please fill it in so that we'll know what to improve and what to do for future sessions. Our next session will be on vaginismus. It's a panel discussion in about half an hour's time. Okay. Yeah, back to Martha.
Yeah, thank you so much, Physician Edmund. It was really, really good. It was really good. I was so impressed.
Thank you so much.
Oh, we can stop recording. I was so impressed